functional movement screen is a test that incorporates functional movements to help decrease the risk of musculoskeletal injury in sport. Over the last 30 years, sports rehabilitation has moved away from an isolated joint and range of movement muscular strength assessment towards an integrated functional approach. I like the functional movement screening system, which captures fundamental movement patterns. This system is simple, reproducible, and validated, and captures musculoskeletal weaknesses, asymmetries, limitations, imbalances, which can lead to injury if not corrected. This system is very popular in the United States. In fact, they use it at the Michael Johnson's Performance Center and the University of Zagreb in Croatia. It has 7 movements: deep squat, hurdle step, inline lunge, shoulder mobility, active straight leg raise, trunk stability, and rotary stability. Hello, I'm with Sasha, England netball star, and today we're going to be doing some functional movement screening to look at some of her strengths, weaknesses, limitations, and asymmetries from a musculoskeletal point of view. The first test is the deep squat. The squat is a movement needed in most athletic events. This is Emily, and today we're going to do functional movement screening with someone who's not a pro. So this should be very interesting. The squat is the ready position and is required for most power and lifting movements involving the lower extremities. The hurdle step is designed to challenge the body's proper stride mechanics during a stepping motion. The movement requires proper coordination and stability between the hips and torso, as well as single leg stance stability. The next test is the inline lunge. This test attempts to place the body in a position that will focus on stresses during rotation, deceleration, and lateral type movements. The next test is the shoulder mobility. Now this is a very important test because if you're weak on this particular test, you could have problems with throwing, whether it's a baseball, a basketball, or a netball. The next test is active straight leg raise. Poor performance can be a result of hamstring flexibility problems. And if you have these flexibility problems, this can lead to hamstring pulls, which can take you out for a season for at least 6 to 8 weeks. Trunk stability push-up is the next test, which tests the ability to stabilize the spine. Many activities require trunk stability, for example, jumping and rebounding. The final test is rotary stability. This is a very complex movement requiring proper neuromuscular coordination and energy transfer from one segment of the body to another. Many activities require trunk stability, such as running and carrying heavy objects. The point of any athletic screening tool is to identify the risk of injury. I find the functional movement screening system to be ideal for this purpose.